Hi, my name is Eric Sines. I'm a family nurse practitioner here. I'll be evaluating your newborn here. I want to hand sanitize, and then here I'll be putting gloves on. I want to begin by congratulating the parent, and I want to ask them some questions about their history throughout their pregnancy, like were they taking prenatal vitamins, and if how was the labor and delivery and any complications that happened here. I want to know the health during her pregnancy. Did she have any bleeding, any trauma, any hypertension, preeclampsia, any fevers, did she do any drugs or drink alcohol or smoking with the baby? Any vaping with the baby when she was pregnant. I want to ask her how many weeks when she delivered the baby. I want to ask any information that she has of the baby, if the baby was in fetal distress, if she had a vaginal delivery or a C-section, did they use any forceps to take the baby out, any breech delivery or any anesthesia for the baby. And I want to know, did the baby have any problems breathing during the labor? Was the baby who needs to go to the ICU or had hyperbilirubinemia? If the baby has any feeding problems since then, and if the baby had to stay a long time in the hospital after being delivered, or if the baby had issues with the birth weight upon delivery. I want to ask if the mother's breastfeeding, if she's having issues with that, if the baby is being bottle fed, if so, what type of formula. I want to know frequency and amount that she's feeding the baby. I want to know that if anything's causing issues with the formulas being changed or anything like that. I want to know if the mother's aware, describing the stool, the color and characteristics of the stool, if there's any diarrhea, if the baby's having difficulty having bowel movements with constipation, has the baby vomited, has there any melena or hemesthesia, or any jaundice or abdominal pain, or if the baby has problems with the appetite or has been a colicky baby. I want to know about the urine, how frequent they're changing the diapers, and if there's any pain there, or blood, or any discharge, or any abdominal pain. I want to know if there's any problems with, releasing the urine or any crying when that happens. And I also want to know the baby, any other issues that the baby's having during the time of a pregnancy to now. And then, of course, here we would be taking the vital signs, and normal vital signs for a baby is 97 to 98.6. Normally for heart rate, it's about 120 to 160 beats per minute. Respiratory rate is 40 to 60 for a baby. Blood pressure is systolic 60 through 80, and then diastolic between 30 to 45, and oxidation saturation is 95 to 100 for the baby. So the baby's vital signs are stable. Here we would begin just an overview of the baby, taking their weight, doing the length of the baby, doing the circumference of the baby, and then of course we would plot these and get the percentile for the baby. We want to know if the baby looks jaundiced, the color of the baby. We want to know the tone, if it's floppy, super floppy, or if it's a stiff tone, it's also not good. We want to see any lesions or birthmarks on the baby, or any of the skin here, any Mongolian spots, nevi, hemangiomas, if any issues with lymph nodes and the turgor of the baby. We want to see if there's any milia, which is just some white spots on the baby. Looks like baby acne, and we want to reassure the parents that that would go away. And then we're looking at the head, the fontanelles, the anterior and the posterior fontanelles. They should be flat. They should not be sunken in because they could be dehydrated. We want to let the parents know that the back closes in a few weeks of life. But 9 to 18 months is usually the front fontanelle, and just tell the parents to be careful not to press on that. We want to look at the shape of the head. We want to see that it's symmetrical. If it's a cone shape, it's usually because of the birth canal from when the delivery happened. And if the cone shape doesn't go away, then we can send the baby for molding, cranial molding later. But usually the cone shape is something more normal. Nose, we want to make sure there's no external lesions. The mucosa is not inflamed. Septum and turbinates are normal. Of course, we're going to want to look for patency for the baby. We want to assess the palate and the mouth. We want to put our pinky in the mouth to assess the palate, see if there's any cleft lip or cleft palate, the roof of the mouth, any Epstein pearls, these white cyst forms in the mouth that you don't do anything about. They'll educate the parent, they'll go away. We want to look at the lips, if there's no lesions, that the tongue comes out past the line, and that that the baby's sucking your finger and the swallow is intact here. The eyes, we're looking at the eyelids. We're looking to see if they have the red light reflex. If their eyes have any jaundice, we can use the ophthalmoscope here as well. We're looking for a big issue that would be corneoblastoma. We'd want to refer them out if that was the case. We want to see if there's any strabismus with the eyes going towards the nose. Normal palpebral fissures, and that the extraocular movement is okay. And just looking at the sclera, make sure it's white. And then we also want to use the otoscope to look in the ears. Make sure that the external auditory canal is clear, and that the tympanic membrane is clear and translucent, and has some mobility to it. Now we're going to look at the cardiovascular. We're first going to look for any heaves, lifts, or any bounding or anything, and then we want to look directly on the skin, check that chest cavity looks okay, there's a rise, it's symmetrical, and that make sure that the heart rate is normal. And one of the biggest things we want to see if there's any murmurs. Certain murmurs, will go away. Then we'll be checking for this. Here you can use the heart, pulmonic, aortic, pulmonic, tricuspid, mitral, and there's also Erb's point. Aortic, pulmonic, tricuspid, mitral. And then we want to inspect the chest rise to look for the lungs. And we want to make sure that those are clear to auscultation and percussion. So we'll just be listening. Same thing in the back. And then clear here to percussion. The abdomen, we want to listen before you feel. We want to, inspect it first, and the abdomen should be soft. We want to check the umbilical cord, make sure it's not infected, drying out. We want to tell parents not to pull anything on the umbilical cord. Make sure when they're putting a diaper to put the diaper below the umbilical cord, and educate parents not to give the baby a bath until the umbilical cord falls off, which should be about a week or two. And then we want to see no presence of hernias, and we can palpate the liver and spleen here as well. But first we want to auscultate the lungs, the abdomen. Usually here it would be like a minute or 2 minutes. Okay. And then we palpate soft and then hard, and then you can feel no organomegaly here. And then for GU, since we're down here, I'll take the diaper out. And then if it was a boy, you want to make sure the testes are descended. And if it's girls and boys, open passage for urine and stool. Normal genitalia for both. No abnormalities. And since we're here, we want to do the femoral pulses one at a time. And then we also want to remember our pulses for our radial and our dorsalis pedis. So all pulses are strong, equal bilaterally. Since the baby's naked here, since we just checked the genitalia, we want to look, see if there's any sacral dimples or any non-symmetrical lines above the crease of the buttocks. If any irregularities here, we can send them out for ultrasound. Musculoskeletal, we're looking at the hip. So we don't want any hip dysplasia here, so we do the Barlow-Ortolani test. The Barlows, you pull the legs out and pull to the middle. And if you're a clunk or a pop sound, then we know that's not good. And then the ortolani is you pull the legs together in the middle, bend the knees 90 degrees, and pull towards you and out. And if there's any pop sounds, then we would send them out. That's not normal. We also want to check the legs. We don't want the legs or the extremities to be floppy. We also don't want the tone to be super rigid and stiff. We want to make sure they have 5 fingers, 5 toes. Normal. We want to inspect the color, make sure the towel appearance it's normal for purplish. Especially if the baby's cold or crying, but the color should return. And if the baby is not in any distress, this will be okay. But if it continues and it's a problem, they can always come, but it's generally normal. Neuro-wise, we want to do the 5 reflexes to make sure the CNS, central nervous system, is okay. So the rooting reflex, we would stroke the corners of the mouth, and the head should turn where we're stroking. The sucking reflex, stick finger in the mouth, and the baby should suck it. And then we also want to do the tonic neck reflex. So when your baby's lying down, their head is turned to the right or the left, the corresponding arm extends. And then while the other arm bends next to their head. So the grasp reflex, they will just grab our hands here. And she grabbed them. The stepping reflex, we pick up the baby. They kind of can walk, kind of looks like they're dancing. The moral reflex is when you startle the baby, you quickly put their back. Their arms should just abruptly fall backwards, but then they should bring them back immediately. Babinski's is for babies. We just stroke the bottom of the feet. Of course, their toes should fan out. That would be abnormal for an adult. We do want to discuss plan of care for the patients. We want to educate the patients what it's going to look like. So they just had their baby. This is a newborn assessment. They just here within the week of having the baby. So they should know that the baby should come after a month to see a nurse or doctor, 2 months, 4 months, 6 months, 9 months. But by the next time they come, it'll be by 2 months, we want to educate them that what they should be seeing with their baby. Is their baby lifting their head? When lying on their stomach, they can look at your face. They should be able to smile at this point and react to loud sounds. And then we'll give them like milestone information so that way they anticipate their next appointments. And every time they come, we'll be doing this for the next ones, not over bombard them. And then we want to tell them the immunizations due first, which, they received the hepatitis B when she was born. But the next 2-month visit, she'll have the Tdap, she'll have the polio, she'll have the pneumococcal PCV, she'll have the Haemophilus influenza type B, and the rotavirus and the hepatitis B. And then, of course, she'll need more vaccines. So the 4-month visit, 6-month visit, 12-month visit, 15-month visit, 18-month visit, and before starting kindergarten. So we'll continue to discuss this as the time goes and give them this anticipatory guidance. We want to also know, how are the parents doing? Are they overwhelmed? Do they have any questions? Do they need any resources, any tools? Any reason for a social worker? Is the baby safe? Does it have formula? Is it breastfeeding correctly? Do we need a consultation here to help the mother? Do we know the eyes and nose of the baby, the poop, the bowel movements, and the wet diapers? There's an app that we can refer them to, the baby tracker, to help them keep track of this. I want to know things about safety. Does the family have firearms? Anybody smoke cigarettes at home? Any access to clean water, electricity, and these sorts of things. And then we want to make sure that the mom's okay and that she's aware of the signs and symptoms of postpartum depression. Also, we want to evaluate if the parents are okay and up to speed with the car seat. Do they know that it's should be rear facing and what the clip looks like at the baby? And that we never leave the baby in the car because they can aspirate if we leave them in for too long. And then, do we know how to sleep with the baby? The risks of SIDS is real, and the baby should be nothing in the crib or nothing in the bassinet. No blankets on the baby. It should be one extra layer of clothing that we wear. So the baby's clothing, one extra layer is sufficient for a baby, and never any other stuffed animals or anything that can stop the baby from breathing or suffocate. Then I want to thank the parents. I want to congratulate them, and I look forward to seeing them again. And thank you very much.